Let your heart beat next to mine. Oh, 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 you're so fine, and you're mine. Okay, I'm done. Sorry, I was fucking around. What's up, guys? You've just tuned into PooseBoss, where we talk sex, dating, relationships, and all things pussy. I just love saying that, I'm not gonna lie. It's so much fun. Okay, so obviously we've talked a lot this week about plastic surgery, and I don't know if you want to get it. It's up to you, girlfriend. Okay, I ain't hating. I'm just trying to give you some info. Okay, so if you think about getting some plastic surgery, but you're not sure where to start or how, I want to help you with choosing the right cosmetic surgeon. How to make sure that you're with the right person, the person you need to, be hollering at, and make sure that you can see. First off, first thing you want to do, boom, PooseBoss tips. Here we go. I'm all over the place. I can't help it today. I'm just in such a good mood. I'm not even going to lie. All right, so the first one, you want to make sure that the surgeon is a board certified. Board certified is so important. A lot of people actually think that medical boards ensure that surgeons are qualified to perform the procedures they advertise, but the fact is the government does not require a surgeon to be specifically trained in the procedures they offer. So because of this, you want to make sure that they are specifically trained in whatever it is that you are looking for. There's a lot of good websites as well where you can search different types of surgeons and doctors. You can literally go to AmericanBoardCosmeticSurgery.org and find tons of resources there. Number two, you want to confirm the surgeon's experience in the specific procedures you want. So one thing I did see when I was kind of doing all this research is I found a lot of girls who, they went to the surgeon before for other procedures such as breast augmentation, or maybe they got some fillers done and they had great experience. So they just assumed that they would be able to do the rhinoplasty or the butt augmentation. And in turn, with that, because they didn't go and do their proper due diligence, what happened? Well, they literally got a botched job because that was not their specialty. So each area of cosmetic surgery requires a different skill. You need to know on how to operate on certain things and do things. So you need to make sure the cosmetic surgeon has the specialties within the field. What questions should you ask? How do you train in your procedure? I am considering. How many years have you been performing this procedure, and how many times have you performed this procedure? Basic questions. And don't be scared to ask. I always found like people are scared. I'm not scared at all. Like, I want to know. And one thing I've also noticed is if you don't ask, they won't always fucking tell you. Like, I remember when I first went to get fillers, I was a little pissed off because I went to get fillers, I asked about it, I signed the sheet, and right before they go to like put in the fillers into my labia folds, she goes, how did she put it? Oh, by the way, if after this your face goes white or you get a white patch or something like that, just go to the hospital and they'll be able to give you something there. And I was like, what the fuck? Why didn't you guys like tell me this before? I mean, I know I signed the paper, right? Like, let's be honest. I signed the paper. So, duh. Bitch, you should have, like, I guess read the paper better. I thought I did, but I didn't read it good enough. But that's the truth. Like, nobody told me. Luckily, she said something. I was like, hold on. What? Like, she literally made me kind of not want to do it anymore. And then I was like, oh, well, no. And nobody had talked about it was really bad. Like, actually, I went in to get the labia folds, right? And my girlfriend had said when I went to go get that, she goes, if you get rid of your labia folds here, she's like, how are you going to have cheeks then? Because then you won't have no definition. So I was like, oh, then I'd have to get my cheeks done. She was right. So then I was talking to the RN or whatever, and I was like, so does that mean I need to get my cheeks done? She's like, well, yeah, she has a point, but we'll just put a little bit in there. It was the most waste of my money, guys. I wasted $600. I don't even want to talk about it anymore. Anyways, number 3, choose a surgeon. I'm sorry. I'm all over the place. Number 3, choose a surgeon whose aesthetic sense appeals to you. appeals to you. Basically, don't not do your research. Even for my stupid ass lashes, I do research. I look at pictures. I go to Yelp reviews. Like, everything I do is always research before I let anybody touch my body. That's not true, because I have let some really disgusting people touch my body. Specifically men, but God, the things I've done. But yeah, you know, somebody, you know, it is good to use somebody that you find that looks good or has work done that you find is beautiful and that you can, you know, kind of get a recommendation from. But you should also look at the surgeon's before and after photos. A lot of them have them online. And look at the same patients that you're looking for, right? So for facial procedures, you want to look for patients who have a similar facial structure, are around your age, and have the same concerns, whether it's a sagging neck or the hump on your nose. Okay, like this is going to be important when you're looking for your own self. For breast procedures, you want to look for patients who have a similar torso and breast shape. For instance, if you have a narrow shoulders and widely spaced small asymmetrical breasts. I don't know why I'm touching my breasts right now, but it just feels like I should. Patients with those qualities in the before images will give you a better sense of how the surgeon tailors the procedure to you. And then for body procedures, you want to look at patients who have a similar shape to you. So if you tend to carry extra weight around your hips or have a sagging tummy, look at patients like that. And also then you want to just look for consistency within the results. And then of course, you want to pay attention to how the surgeon and the staff make you feel. I do think this is a big deal because I've also talked to other people who, okay, this one girl I know, she'd gotten a nose job, and the day of the nose job, the cast fell off, okay? And she went in to get the cast, I guess, removed or whatever, removed or something. And she told them the cast fell off, and they literally just told her, oh, it's fine, you don't need a cast. Or she called them, I can't remember. Look, I'm telling the story wrong. But the truth is that at the end of it, she didn't feel comfortable with the surgeon, right? So you want to make sure to ask yourself these questions. Do you like spending time with the surgeon? Do you trust the surgeon? And do you feel comfortable asking them questions? Because again, asking questions is so, so, so important. If you don't ask questions, you won't get answers. And ultimately, you want to feel like everything is clearly stated. The fees, is it all inclusive? Who do you contact if you need if you prompt reply? Do you get materials after the surgery? Are there risks with the surgery? What is the recovery like? Okay, things like that. Am I going to need someone to help me? These are all things that you should really, really just think about before you A, book the surgery, B, even get the doctor. I mean, it's so important. And like I said, there's lots of stuff online where you can find this information and use it for yourself. But I mean, this kind of stuff, like, who wants to read this shit? Plus, I don't want to read about this. Like, I don't want to actually look up a doctor. Like, can't somebody just tell me? All I want to do is, I'm not even going to lie, I don't want to look up a doctor. I just want to go to Dr. Orion, who the Kardashians go to, because I already know they're the bomb, right? Dr. Orion's the best. Duh. So, like, I'm just going to pay the $500 consultation fee. Yes, it is a $500 consultation fee for Dr. Orion. It does go towards your service. So, I mean, whatever. But I just would like to go to him, just be like, hi, make me beautiful. Tell me what you would do to me. I would just like him to tell me what he would do to me. It's not even like I think I would do it per se. I just want to hear, like, do you think I'm pretty? Is that like really egotistical? So we'd be like, you think I'm pretty? Do you think I'm pretty? He'd probably be like, well, yeah, but you could have like enhanced this. I don't know. I mean, I definitely, like, for me, I will say this. My lip fillers, I got it laser away, guys. So it wasn't much research there. My Botox, laser away. But these are not things that are going to change my whole entire face or body. if I actually, like I am kind of looking into a non-surgical facelift, right? Whatever the little stringy thingy was-y. Because it's either that or fillers. So the one thing I was told, right, to fix myself and make myself look more gorgeous than I already do, is to basically put fillers right here in my cheeks, because it will lift up a little bit, right? Like, look at it. Oh, look how good I already look when I lift. When I lift my eyes, I look amazing. I look like I'm 18. That's a lie. But anyways, I want to pretend like I look like I'm 18. So I could do the little fillers, right? But the thing is I really don't like the idea of fillers. I'm worried it's gonna stretch out my skin. I don't know why. This is a worry to me. Older, fine. Fillers, fine when you're older. But like young, I just am worried about looking weird like a chipmunk. So, I don't know. I'm just worried about fillers. So I was thinking of doing, you know, the non-surgical facelift that, you know, helps, that supposedly, and I looked into that, and you know, it was hard because there's so many doctors. You want to know how I picked the one that I wanted to this is so bad. I'm giving you all these tips and I'm going to tell you exactly how obviously I didn't get it done, okay? But the guy that the website that I ended up on from the doctor, I mean, he had really good ratings. Well, he had good ratings. He had like, you know, 5 stars or whatever. I don't know. He had enough that it made me feel comfortable to click on the website. But he was also hot. I mean, he was so hot. I was like, I think I should just go for a consultation to see if he's single. Like, seriously. Could you imagine, like, marrying a doctor? Oh, that's so hot. Well, specifically a plastic surgeon. You'd be like, babe, I need my Botox. I would like make sure you would always be looking good. I guess you'd have to because of him, and then maybe you'd feel like even less of I don't know, but I would kind of like that just to get my little, you know, what are they, touch-ups. Babe, you don't need to change my whole face. Just give me my touch-ups. There's like a couple things like right to marry, like plastic surgeon. For me, sorry, I just saw a bug. I don't know. Why did I go off onto what kind of man I want to marry? That's really weird. All right, that's it. I'm done with my surgeon checklist. Actually, I'm going to go try to find that surgeon that I was checking out online. I think I'm going to book a consultation with him right now because girl's trying to find her husband. Boop, boop. No, I'm not. For real. Actually, I don't even want to. I'm just trying to get me a new face. Just kidding. All right, it's the PooseBoss signing off. And as always, ladies, gents, remember to keep patting that puss.